Hello and welcome to American CME. I'm Jeff Lassers, firefighter, paramedic, and EMS-IC. This training has been developed to assist with the implementation of the Narcan special study being conducted within medical control authorities in Southeast Michigan. The state of Michigan has adopted a new law that requires Narcan to be carried on all licensed MFR and BLS EMS units. Essentially, this law dictates that these units carry Narcan in a pre-filled syringe to be administered to patients via the intranasal route when indicated for the complete or partial reversal of opioid-induced respiratory depression caused by a narcotic overdose. The state of Michigan recently established protocols that meet the standards of the new law. However, the Michigan Department of Health and Human Services has approved a special study that allows multiple medical control authorities in Southeast Michigan to use different protocols for administering Narcan to opioid overdose patients. These special study protocols allow EMS personnel that are working on MFR or BLS units to draw up Narcan from a vial and administer via the intranasal route, rather than using a pre-filled syringe. The Narcan will be stored in a medication kit, which contains 2 vials of Narcan along with the equipment to draw up and administer the drug to the patient. Utilizing a vial of Narcan is a more cost-effective method to meet the standards of the new law. To accomplish the cost savings, MFRs and EMT basics must learn to draw up Narcan from a vial, which they are not currently trained to do. We will demonstrate how to do just that in this training to help MFRs and EMTs learn these new skills. However, this video is designed to accompany a practical skills session with an instructor. It's important to note that this special study may also impact paramedics. Narcan is not a new drug to paramedics, nor is drawing up a medication from a vial. However, many advanced life support agencies that are a part of this special study staff paramedics on BLS and MFR units. An example of this would be a firefighter/paramedic staffed on a piece of fire apparatus, such as an engine, a ladder truck, or a tanker, which may be licensed as an MFR or BLS unit in the state of Michigan. Therefore, all EMS providers, including paramedics that work for an organization that respond with licensed MFR or BLS units, might utilize the new medication kits in the field. All EMS personnel that are part of this special study must understand the new Narcan protocols, become familiar with the contents of the medication kit, identify the MFR and/or BLS units the kits will be stored on at their agency, and understand how to complete the necessary documentation after a kit has been used in the field. In addition, EMTs and MFRs must also complete practical skill training to assure they become comfortable with the skills of drawing up and administering Narcan IN. Paramedics are not required to complete the associated practical skill training. During this video training, we will cover the associated protocols for all license levels, as well as demonstrate how to draw up and administer intranasal Narcan. Later, an instructor will cover the rest of the objectives with you during live training sessions. The MFR BLS opioid overdose Narcan administration protocol applies to any patient that has signs of a narcotic overdose and signs of respiratory depression. When the receptors in the brain are overwhelmed by an opioid, like heroin, the receptors slow, then stop the body's ability to breathe. Narcan, also known as naloxone, is an antagonist to narcotics, meaning it has a stronger attraction to the brain's receptors and displaces the opioids long enough to allow breathing to resume. Narcan is an antagonist only to opioid narcotics and is not effective with other medications. It will not reverse benzodiazepines, sedative hypnotics, alcohol, or any other class of drugs. The intranasal route is an attractive method of Narcan delivery due to the rich vascular network of the nasal cavity. When Narcan is atomized into a patient's nose, it absorbs directly into the bloodstream through the mucous membranes. This method of drug administration, which is approved for MFRs and EMTs, is essentially painless, does not require sterile technique, IV catheters, or other invasive devices, and it is immediately and readily available in all patients. Per the protocol, Narcan is indicated for the complete or partial reversal of opioid-induced respiratory depression caused by opioid narcotic medications such as heroin or any of the other medications seen here. no contraindications are associated with this protocol. This protocol refers to multiple related protocols and procedures that may apply to patients suffering from an opioid overdose. These are listed clearly in the protocol. The general pre-hospital care protocol refers to the initial actions and considerations to take for every EMS call that providers encounter. Here are a few key considerations that apply. Always ensure scene safety. Personnel may need to remove themselves from an unsafe or potentially unsafe environment. Call for additional resources such as PD when necessary. In addition, some situations may require moving the patient to a safe environment. Maintain appropriate body substance isolation. Assess airway, breathing, and circulation. Most importantly, provide airway intervention using appropriate airway adjuncts when necessary. This is particularly important when dealing with a narcotic overdose patient. Maintain an open airway and assist ventilations for any patient with respiratory depression or arrest. Airway management may include repositioning of the airway, suctioning, placing airway adjuncts, and administering oxygen. Obtain a pertinent medical history to identify if the patient has taken any narcotics. Obtain vital signs, including pulse oximetry, if available. And finally, ensure an ALS response. The cardiac arrest procedure should be followed for any patient in cardiac arrest. Pulseless and apneic patients require high-quality CPR and the use of an AED. In these situations, CPR takes precedence over any other treatment or procedure, including administration of Narcan. Any patient with an altered mental status with adequate breathing does not require Narcan. In these situations, EMTs should measure the patient's blood glucose level. If it is less than 60 milligrams per deciliter, administer oral glucose paste, buccally or sublingual. For a known diabetic, MFRs should consider small amounts of oral glucose paste. The respiratory distress protocol and the emergency airway procedure should be referred to for any patient with inadequate breathing. It is of the utmost importance to maintain an open airway and provide oxygen and ventilations when indicated. For opioid overdose patients, emphasis must be placed on basic airway management prior to Narcan administration. Use of supraglottic airway devices, such as the King Airway or Combi tube, should be avoided for patients with suspicion of an opioid overdose. It is likely that after Narcan is administered to the patient, they will have a return of normal respirations and may become responsive. Using basic airway adjuncts, such as an OPA, will be more effective and easier to remove if a patient becomes responsive and breathing returns to normal. Remember, Narcan is indicated for any patient that has signs of an opioid overdose and signs of respiratory depression. Once you have identified a patient with an indication for Narcan, you must then draw up and administer the drug via the intranasal route. First, open the patient's airway and provide adequate basic airway maneuvers. Then, using a vial access cannula on a 3 milliliter syringe, draw up the entire 1 milliliter vial of Narcan. To do this, attach the vial access cannula to a 3 milliliter syringe. Pull the plunger of the syringe so that it rests at the 1 milliliter mark. Puncture the vial with the cannula attached to the syringe and then flip the vial upside down. Push the plunger so that the 1 milliliter of air is injected into the vial. Draw up the entire 1 milliliter volume of the vial. Make sure that the tip of the cannula is at the very top of the vial as you draw up the medication. This will ensure that the entire volume of the medication is drawn into the syringe. Then, remove the vial access cannula from the syringe and attach the atomizing device. Holding the syringe with the atomizing device up, remove excess air from the syringe without wasting the Narcan. Use one hand to support the back of the patient's head as needed. Place the tip of the atomizing device snugly against the nostril, aiming slightly upward and outward. Rapidly administer the entire dose of the medication, briskly pushing the plunger. The treatment goal is to produce adequate breathing. The patient need not be woken up completely. If after 3 minutes you do not see any change in the patient's breathing, use the other vial in your medication kit and repeat the process of drawing up and administering the Narcan in the other nostril. Finally, maintain adequate basic airway management throughout the entire process of patient care as needed in these situations. We've just covered the protocol and demonstrated how to draw up and administer Narcan IN. An instructor or someone from your agency's administration will be able to answer any questions you may have regarding the information presented in this training. Now, an instructor will provide you with additional training so that you are familiar with the contents of the medication kit. Identify the BLS and/or MFR units at your agency that the kits will be stored on, and demonstrate how to complete the necessary documentation after the kit has been used in the field. Finally, it is crucial that the MFRs and EMTs that are a part of this special study complete the associated hands-on practical training and become comfortable with the skills of drawing up and administering Narcan. This completes the American CME training on the implementation of the Narcan special study being conducted within medical control authorities in Southeast Michigan. Thank you for watching and have a great day.